HIV stands for Human Immunodeficiency Virus and is a virus that attacks and weakens your immune system until your body can no longer protect itself. AIDS is the final stage of HIV and stands for Acquired Immunodeficiency Syndrome. By the time you have AIDS, your body's resistance to infection is incredibly poor and your lifespan diminishes severely.
In the beginning, people were scared and confused about HIV/AIDS. Until recently, people didn't know where HIV came from. It is believed to originate from chimpanzees in the Congo, finding the virus in blood samples. Nobody knows how this happened, but one of the earliest cases occurred in the 50s from a man's plasma sample in the Congo, where it originated from. From there, it spread until in the 80s, it became the epidemic that we know today. In the United States, HIV is spread mainly by having sex or sharing injection drug equipment, such as needles, with someone who has HIV. Only certain fluids, such as blood, semen, preseminal fluid, rectal fluids, vaginal fluids, and breast milk from an HIV-injected person can transmit HIV. How you can get these are through sexual contact, injection drug use, pregnancy, breastfeeding, occupational exposure, blood transfusion, or an organ transplant.
The first stage of HIV is the acute infection stage. Most people will begin to experience severe flu-like symptoms, such as fever or sore throat, about 2 to 4 weeks after becoming infected. These first symptoms can last for only several days or weeks. The second stage of HIV is termed clinical latency stage, and in this stage, the virus is developing inside the body but is not producing any symptoms. This stage can last for decades if the patient is being treated, but if not, the typical duration of the stage is about 10 years. The final stage of HIV is AIDS and is the most severe. At this point, the immune system is very weakened and the body is open to more diseases, called opportunistic infections. Without treatment, this stage will last about 3 years until death. Symptoms of AIDS include rapid weight loss, extreme tiredness, swollen lymph glands, and sores and colored blotches on the skin.
The HIV test is designed to detect antibodies to HIV in your blood or saliva. Antibodies are proteins produced by your body when you have an infection, and they help fight against the infection. When a person becomes infected with HIV, their body will produce specific antibodies to combat against the infection. HIV antibodies are different than antibodies produced for different viruses. If the test finds that a person's blood contains HIV antibodies, then they are infected with the HIV virus. The HIV test only indicates whether a person is infected with the virus, and not if the person has AIDS, the length or severity of the infection. HIV testing sites are either confidential or anonymous to help ensure maximum comfort of the person getting tested. Most testing sites provide on-site counselors to help explain the process and answer any questions people may have. A common method of HIV testing involves the extraction of a small sample of blood and testing this sample using a northern blot. Another method of testing is called OraSure, which involves a toothbrush-like probe that sits between the teeth and gums for about 4 minutes. Results for both of these tests take about 1 to 2 weeks. A more rapid test involves a finger prick, which can produce results in 30 minutes, but this test is limited to well-equipped hospitals, making it harder to come across.
Because there are no cures for HIV, there have been discoveries of treatments that delay the development of it, called AZT. They consist of cocktail drugs, which is a combination of different drugs in order to attack the virus in a way best suited for the patient. Taking more than one drug at a time makes it harder for the mutations that the virus makes to overcome the medicine. Antiretrovirals prevent the virus from replicating in the body and are taken in these combinations in order to maximize effectiveness, which is to slow the development of AIDS. To prevent getting infected with AIDS, you should always use condoms and educate yourself about AIDS and the symptoms of it. Be honest with your partner and make sure they are honest with you. If you are using needles to inject a drug, make sure that it is clean and sterile.
go back out this weekend.
I know, me too. I'm so excited. I had such a good weekend last weekend.
What'd you do?
I went to this party. I don't really remember all of it, but I hooked up with this guy. So
Did you use protection?
no, I don't. He didn't have anything, so
You didn't use a condom?
no.
He could have an STI.
I mean, I doubt it though.
That's really dangerous. He could have AIDS.
That's okay. That's a lot. That's big.
I mean, 1 in 6 people who have HIV don't even know it.
Wow.
You should get yourself tested.
Yeah. I guess if I see something coming on, then like.
No, you should really get it tested as soon as possible because the sooner you get tested, the sooner you can start treating it.
Well, okay. I guess I don't really have his number, which kind of scares me a little bit. I don't know. Well, when should I make the appointment?
You should make it as soon as possible. I can take you tomorrow.